everyone, this is Catherine Bauma again. I'm just doing the final video in the Top 50 Drugs series. This one is on the top 12 drugs concerning the adverse effects and patient consultation points. Let's go ahead and get started. First drug again is levothyroxine sodium. Adverse effects, well, there's not too many for this medication actually. Basically, any adverse effects other than those indicative of overdosage are rare. Overdosage can result in hypermetabolic states resembling those of endogenous origin. Effects include fever, hypoglycemia, heart failure, fluid loss, tachycardia, anxiety, and insomnia. Some patient consultation points here are: do not discontinue therapy without first consulting a physician. Take on an empty stomach 1 hour before or 2 hours following a meal. Notify physician if signs of hyperthyroidism or overdosage occurs. And transient loss of hair may be seen in children, but recovery usually occurs. Next drug here is hydrocodone bitartrate with acetaminophen. Adverse effects include dizziness, drowsiness, constipation, nausea, or vomiting. That's why you'll often see this medication prescribed with some sort of over-the-counter stool softener when your patients come in after just being discharged. Some consultation points are here. May cause drowsiness. Use caution while operating machinery or when mental alertness is required. Avoid alcohol while taking this medication. And you can take this medication with food or milk to avoid GI upset. And this medication may be habit forming, which is why it's a controlled substance. Lisinopril. Adverse effects include dizziness in about 6%, headache in 5%, fatigue in 3%, cough in 3%, and diarrhea in 3%. Some consultation points are here. You can take it with or without food. Don't discontinue this medication unless otherwise directed by your physician. Avoid any salt substitutes containing potassium, and just contact a physician if any swelling occurs. Next drug is omeprazole. Adverse effects are here, but they're very rare. Some include back pain, cough, constipation, rash, and dizziness. For the patient consultation points, just be sure to take 30 minutes prior to eating. You can also take your antacids at the same time. If you miss your dose, take it as soon as possible. But if it's closer to the time of your next dose than the dose you missed, just skip the missed dose and return to your normal dosing schedule. Do not double dose. For patients who have difficulty swallowing these capsules, the contents of the capsule can be added to 1 tablespoon of applesauce, swallowed immediately and followed with a glass of cool water. The contents should not be chewed or crushed. Next drug here is amlodipine benzoate. Adverse effects include edema, flushing, headache, fatigue, and abdominal pain. For consultation points here, you don't have to take this one with food, but you can. You can contact a physician if any of these side effects become too severe. If your dose is missed, take as soon as possible. If taken within 12 hours of the next dose, just skip the next dose and return to schedule. Don't take any over-the-counter cough or cold remedies without checking with your physician or pharmacist. And do not stop therapy unless directed to do so by a physician. Next drug is simvastatin. Adverse effects are constipation in 2.3%. Muscle pain is rare, but you often hear of muscle pain associated with the statin drugs. And dyspepsia in about 1.1%. So not very many side effects are possible. Pretty low percentage chance, but I think the number one important one to be attentive to in this case is the muscle pain. For patient consultation points, just contact a physician if symptoms of myopathy occur. That's that muscle pain, tenderness, especially if accompanied by malaise or fever. As you looked up on your little sheet for the lexicon assignment, malaise is just like a feeling of general uneasiness, just so you know. Closely follow your prescribed diet. Avoid overexposure to sunlight due to possibility of photosensitivity. Use sunscreen and wear appropriate clothing until the level of sensitivity is determined. Also, do not become pregnant during therapy. If pregnant occurs or is suspected, just discontinue the medication and consult a physician. Limit alcohol intake during therapy, and grapefruit juice increases plasma levels and should be avoided. That's a very important point. I am sure it will be asked on the test. Next drug here is metformin hydrochloride. Adverse effects include decreased vitamin B12 absorption, lactic acidosis, diarrhea, vomiting, nausea, flatulence, anorexia, bloating, and an unpleasant metallic taste. Adverse GI effects are transient and disappear once the patient is stabilized. Lactic acidosis is manifested by unexplained hyperventilation, myalgia, malaise, or unusual somnolence. For consultation points here, definitely take with meals. Avoid excessive alcohol consumption during treatment. This includes drinking alcohol all the time or binge drinking for short periods. So probably shouldn't take this one over hobo days. Closely follow the prescribed diet and exercise. Stop your treatment and notify your physician if you experience any of the following symptoms. That's that unexplained hyperventilation, myalgia, malaise, or unusual somnolence. And if you miss your dose by more than a couple hours, skip it and return to your normal dosing schedule. Don't double dose on this one. And keep well hydrated during therapy by drinking plenty of fluids. Next drug here is furosemide. Adverse effects include dizziness, orthostatic hypotension, dry mouth, hearing loss, nausea, vomiting, weakness, muscle cramps, paresthesia, anemia, photosensitivity, purpura, rash, and hyperglycemia. For consultation points, you can take it with food or milk if GI upset occurs. Timing of dose is important because of increased diuresis. This is a really important point, especially for these diuretics. Just know that this medication is given in the early morning because it can cause increased urination or diuresis. With this one, avoid overexposure to sunlight. Don't take with any non-prescription cough or cold medicines, antacids, laxatives, or antidiarrheals without consulting with pharmacist or physician, because these medications can interact with this one. It also can cause orthostatic hypotension. Take appropriate precautions. If dose is missed, take it as soon as possible. If it is closer to the time of your next dose than the dose you missed, skip the missed dose and return to your dosing schedule. Don't double dose. And you'll see that on almost every medication. So if I didn't put it on one of these slides, it's basically this point would be included on any medication, as well as the store in a cool, dried place away from children. That's almost on every medication as well. I just didn't feel the need to include it since it's kind of just so prevalent, I guess. Next medication here is albuterol sulfate inhalation. Adverse effects are nausea, vomiting, nervousness, headache, insomnia, tremor, dizziness, hypertension, tachycardia, and palpitations. Consultation points: do not take more frequently than recommended, and if patients find that the treatment with albuterol becomes less effective for symptomatic relief, their symptoms get worse, or they need to take the product more frequently than usual, Advise them to seek medical attention immediately. And then specifically for the aerosol inhaler, just avoid the contact with the eyes. Shake canister well before each inhalation. Just follow the instructions for inhalation technique. And clean the mouthpiece at least once a week by removing the canister, running warm water through it for 30 seconds, and letting it air dry thoroughly. Next medication is gabapentin. Adverse effects. The most common effects are somnolence in 19%, dizziness in 17%, ataxia in 12%, fatigue in 11%, nystagmus in 8%, tremor in 8%, diplopia in 6%, rhinitis and blurred vision in 4%. And then uncommon but rare adverse effects include elevated creatine kinase and rhabdomyolysis. For consultation points, this medication can cause drowsiness. Use caution while operating machinery or when mental alertness is required. Avoid alcohol while taking this medication. Do not abruptly discontinue therapy. Dose should be tapered over a 1 week period. I feel like that's a pretty important point because I see that quite often while I'm working. This medication can be taken without regard to meals. And then if a dose is missed, take it as soon as possible, but don't double dose again. Torvastatin calcium. Adverse effects. The most frequent adverse effects are constipation, diarrhea, dyspepsia, and flatulence. Contact physician if symptoms of myopathy occur. Again, that's that muscle pain. That's pretty serious, and quite frankly, this drug card makes it seem like it's not that common, but it seems like, at least in my pharmacy, there's several patients who have complained of that. So, just something to be aware of. Patient consultation, just closely follow the prescribed diet. Patients should be placed on a cholesterol-lowering diet before drug therapy and should continue on this diet during treatment. Avoid overexposure to sunlight due to possibility of photosensitivity. Use sunscreen and appropriate clothing until the level of sensitivity is determined. Also, do not become pregnant during therapy if pregnancy is suspected or occurs. Discontinue medication and consult a physician. Limit alcohol intake during therapy and watch for those symptoms of myopathy. And I believe this is the final medication. It's a hydrochlorothiazide. Adverse effects are dry mouth, muscle cramps, nausea, vomiting, anemia, weakness, dizziness, orthostatic hypertension, anorexia, GI distress including diarrhea and constipation, hyperglycemia, photosensitivity, rash, and transient blurred vision. For consultation points, it can be taken with food or milk if GI upset occurs. Again, with this diuretic, timing of dose is important because of that increased diuresis. Give this one early in the morning. Avoid excess exposure to sunlight. And then again, store in that cool, dry place away from sunlight and children. Contact a physician if above side effects are severe or persistent. And if a dose is missed, just skip and return to normal dosing schedule. So I believe that's it for the adverse effects and patient consultation points. Hope you enjoyed these videos, and just let me know if you'd like to see more in the future. Thanks. Bye.